Thank you so much for staying tuned to today's edition of Healthy Living. I am Wilson of Marshall. Well, not a regular anchor, not to worry. Next week, Monday, Oloijo Hikokai will be on the ground to take you through the rudiments that really pertains to health. But today, it is celebrating the World Tuberculosis Day with a theme. Yes, we can't stop tuberculosis. That seems to be the punch line. And that was like, commitment and the rest of them follow suit. All right, with me here in the studio is a consultant, right? Pulmonologist, and of course, a respiratory doctor at the UBTH, Dr. Omoaga. That name is what again, Doc?
Dr. Ibifiri Omoagi.
Yes, Omoagi. Dr. Ibifiri Omoagi. I think I'm getting to get a hang of that name, Ibifiri Omoagi. Welcome to Healthy Living.
Thank you for having me.
All right, tuberculosis. I've heard about that particular, that name, and it seems to strike fear in the hearts of so many individuals, parents, children alike. I like to, refresh our memory for those that used to know the meaning and for those that don't even know about it. What is tuberculosis?
Thank you. So tuberculosis is a disease that affects the whole body, but the commonest place usually is the lungs. Now, it's caused by a bacteria, what we call a germ. And the bacteria gets into the bloodstream through the airway. In some situations, it can actually get in through the bloodstream through consumption of unpasteurized milk. However, commonly through the airway, so from those who are coughing, when they cough and sneeze around you and you inhale, that germ or that bacteria can go down the airway and cause disease, and then from the lungs spread to other parts of the body as well.
So primarily it affects the lungs, but
Yes.
it could be in any part of the body.
Yes.
You talked about a bacteria. Now, what is the mode of transmission aside the coughing, the sneezing? Can it be gotten from domestic animals?
No, well, not necessarily. It's not a zoonotic disease, meaning it can be it's not transferred from animals. It's basically man to man. And then, like I mentioned, in some situations, people that consume unpasteurized milk, like this Fulani, people
like
that
the
take
fura di nono.
exactly.
Yeah.
In some situations, the bacteria can colonize the milk and then get into the airway get into the guts from the intestine and then spread, especially to the bones. So this is what can happen. But commonly the airway, and that's why we are pushing for it to actually be eradicated as much as possible.
All right, some of the people that sometimes you using the same plate, cup or spoons of infected person, that one can really get infected by such acts. How true is this?
Well, we won't really say share cups and spoons. Like in the hospital, what we usually advise for those that have it, it's advisable that for the period of treatment, the first 2 weeks especially, they should have theirs. They shouldn't necessarily share. Not like it would be transmitted, it's a common mode of transmission, but yes, there's some possibility that it can be transmitted via that means. So this is for those who are living in close contact with positive cases, but not commonly. So yeah, but for those who are diagnosed, we advise at home, since you have children, especially around you, you should use your own cups and spoons, pending at least when you've taken the medications for a period of time, at least 2 weeks, like I mentioned, and then you can now go on to live your normal life, of course, while still protecting others from you.
All right, now there's this myth that has it that if one consumes wild cat or domestic cats, that person can contract tuberculosis. How true is this myth?
Well, not necessarily.
This once you just kill a cat, you eat a cat,
No.
you were exposed
No.
to tuberculosis.
No, it's not true, please. Tuberculosis is spread from one person to another commonly. And with that, it's quite common. So the spread is basically man to man. A lot of times you go out, you go to weddings, you don't even know who is coughing around you. Somebody may be coughing and you take it lightly. And then that person can release a lot of organisms into the airway. You breathe it in. Now, of course, there are some people that are at risk of having it. Not everybody will just have tuberculosis. Now, so I'll go ahead and talk about the risk factors.
No. Before we dive into
Okay.
the risk factors, talking about mode of transmission, mention
Yes.
coughing.
Yes.
Aside cough, is there that means one can really contract this disease? Because when you get to hear cough, say, please, hey, cover your nose. Look, don't go close to that man. He's been coughing for quite a while right now. Just avoid the man. Is it just through cough?
Okay. No, not just through cough. So, in the public space, yes, commonly through coughing, sneezing. But, you know, there are some health workers that work in the laboratory and then deal with these organisms directly. For some of them, they may not even have symptoms. But working with you can inhale the droplets. As long as there's anything that makes you inhale those respiratory droplets, you're at risk of coming down with it. Then, like I mentioned, consumption of unpasteurized milk. So those are the two basic modes. Now, for others who have had the latent disease in the body, when the immune system is now suppressed, the disease can rear
So
its
it's a
head.
latent form of tuberculosis,
There's
the
a
bacteria
latent
that
form.
causes it.
Yes, there's a latent form that can now subsequently result in active tuberculosis when the immune system is down. So these are some ways it can rear its head. Yeah.
All right, you get to hear among the 6 deadly diseases they mentioned tuberculosis being among the 6 deadly diseases of children. Is it just children or anyone can be exposed or infected by tuberculosis?
Oh, tuberculosis affects everybody. Children, middle-aged, adults, everybody. But why do we talk about children a lot? You know, the immune system of children is not properly developed. So they are at more risk of developing some of these deadly illnesses compared to those who are middle-aged. And of course, the elderly, they're also at risk because their immune system is less strong compared to those who are middle-aged. So yes, children a lot, adults, but tuberculosis affects everybody. It doesn't have any preference, basically.
All right.
Yeah.
Now, some of these mindsets that since we have a pair of lungs, that if tuberculosis affects just one lung, we are just good. How true is this particular assertion? You say you have a pair, so if one gets infected, you're just okay? Just like, no need to go to the hospital, the other lungs will take care of the other one.
Absolutely not.
Yeah.
Absolutely not. Yes, in some cases, people come early enough with one lung affected.
Yeah.
But a lot of times, it affects both. It's an infection. There's nothing that says this infection will stop here and not spread to the other side. So there are some people that come with both lungs affected. There are some that are lucky enough to have just one affected. And then the organism destroys that lung completely. So yes, the other lung may be functional, but then in the future, there are other airway infections that can also occur and still
Affect the other lungs.
and reduce the functioning of the lungs as well. So it doesn't mean tuberculosis just picks one. No, it can pick both at the same time. As long as treatment is not commenced in time, it will keep spreading. It will keep living there and causing damage. That's how it works. So it doesn't just stick to one alone.
Wow, this is quite scary. Well, Doc, some of the opinion that once you were infected by this particular disease, it's game over. I say no remedy, no cure. What do you feel about this mentality?
That's absolutely not true. Because there's treatment.
There's treatment.
Yes, and it can be cured.
Okay.
It can be cured. The treatment lasts for a certain period of time. Because it's quite long, so a lot of people default and makes it more difficult. So you hear about resistant strains because of lack of compliance to medications. You now have newer strains being formed. So treatment is as long as 6 months. Newer
6 months.
Yes, but the newer treatment regimens are now as low as 4 months. So in the bid to make it easier for compliance, basically. So there's actually a cure. There's cure.
But take the minimum of at least 4 months.
Yes, for the newer drug treatment, the newer treatment plan. But for the one which we still conventionally use, 6 months.
Now, this that might be expensive.
Well, this depends on, the duration actually depends on the part of the body affected. So this is just basically for the lungs and some other parts, commonly 6 months. Now, yes, for the cost, I would say it's quite expensive, but then we're lucky to have the help of the foreign aids,
and donors.
which is still on, and all these are just to help to encourage people to make sure they take their medications. At least you're not paying out of pocket, so it helps to make it easier for treatment to be done. So yes, there's a cure.
There's a cure.
Yes.
All right, but we're talking about the preventive measure. I don't think preventive measures should, like, be encouraged than the curative measures, knowing fully well that, like what you rightly said, some persons, due to one thing or the other, may default in taking the drugs administered.
Okay, yes. So prevention is key in when it comes to any disease. Prevention is the best. Now, how do you prevent a disease? You have to be able to identify the things that can put you at risk of having this disease. So first of all, if you live in a place with someone who already has it, you have to protect yourself. So the first thing we advise in the hospital, use your face mask.
Your face mask?
Yes, and the person who is also having it should also use a face mask if you have to live together with the person. Now, you should also go for what we call there's a test which we do to help look for the latent form. It's kind of a skin test which can be done to help tell if you would need treatment, because the latent form of TB also has its treatment. Okay. Although the drugs are not as at least you just use one medication or two. You don't use the whole normal conventional treatment. Now, other risk factors, what are they? For those who go for live in overcrowded environment. Just imagine one person has tuberculosis in a room where 5 or 10 people are staying. Yeah. That just puts others at risk. People that go for camp programs, church camps, they live in hostels, things like that. So we want to encourage proper aeration of the environment. Now, for those who are immunosuppressed, by that I mean those who are taking maybe medications like chemotherapy for treatment of cancers, those who are diabetic, any form of illness that can actually depress the immune system can put one at risk of tuberculosis. So knowing fully well you have something like that, you must protect yourself. The use of face masks should be non-negotiable in such individuals. Now, for those in the hospital, I told you this disease spreads through the airway.
Yes.
Sharing of things like ventilators without proper sterilization, of course, that is a standard. Everything should be sterilized. So ventilators, the use of nebulizers, even face masks. So most times we see that for every patient we have a face mask for that patient. So sharing of things like that can put you at risk. So you want to avoid all those. And then for children, I'm sure you've heard of BCG with a scar. It leaves a scar on the body. That vaccine is very important, especially in children.
BCG?
Yes. It's a very important vaccine. In fact, it is given on the day or the next day after delivery most times. Now, this vaccine confers good immunity in children. It's not for life. So for some can last as long as 20 years, some 10 years, but it basically targets the younger age group so that you have less, at least, occurrence of tuberculosis in children. That's what it targets. So we want to encourage parents to ensure their children are vaccinated, as well as avoiding the other things which I've mentioned. Alcohol, cigarette smoking, things that can, like cigarette smoking damages some parts of the lungs that helps it to fight infection. So you want to avoid smoking. Alcohol intake as well.
What about those that get involved with shisha? They drag the shisha from one source, the same pipe. They just drag and drag and drag.
That is a terrible risk factor, because imagine one person having it and others are sharing. So it can actually impact on the airway and cause the spread.
All right.
So all those practices are
I just to bring that up, because some of our ladies and the gentlemen in the community like doing the shisha thing. You don't know what's tuberculosis, that you like drag and you share, you pass the dose just like that. Okay, now you talked about talking about the latent form. We talked about also some persons going for a test. Now, is the test restricted to those that are having these signs or symptoms, or is like, advice for everyone to go run a test? Okay, so it's not just a routine for everyone. Like, I'll use my workplace as an example. Before you start working, you must have that test done to know if you require treatment, because you're coming to an environment where you are going to be at risk of coming in contact with patients with such illnesses. So most times before you go to hostels, universities, ideally you should get that done. Now, if you're already having symptoms,
with like cough,
Yeah.
the test to be done for that is different because it means you're already having symptoms. With latent TB, you may not have symptoms. It may just be there. But with active TB, the person is coughing, having the weight loss, night sweats, all the symptoms. There may be blood coming out in the sputum.
Sputum, yeah.
Yes, weight loss, swelling of some of the lymph nodes in the neck, the armpit, and other areas. So when it comes to that, the test, the major test we have on ground now is the cough. We call it Gene Expert.
Okay.
It's free.
It's free.
Right now.
Okay.
Right now.
Okay, for now. Anything can happen.
So it's been free for a while, and we really appreciate that because it has helped us make a whole lot of diagnoses. Now, we encourage people who are actively coughing to come for that. It's free. So you have the health center at, on Sapler Road, and then UBTH, Central Hospital. They can be done, that's Edo Specialist Hospital and Stella Obasanjo. They can be done in those places. But for the other investigations, of course, the chest X-ray, that is not free. That should be done out of pocket. Now, there are other advanced investigations that can be done through the blood.
Oh, through the blood?
Yes, those are way more expensive. So we don't really advocate for that. We keep them for special situations and for those who can really afford them because they're quite expensive. But so like I said, just to differentiate, for those who are living with people who are treating, they're advised to get the latent TB test done. While for those who have active disease, they're advised to go the other route, the Gene Expert, chest X-ray, and other in that line.
So what about individuals that maybe took their own relative to the hospital, not knowing well they're like, suffering from the you feel that they should go for that particular test?
Oh, yes.
You get to see a mother, my baby, please take up my baby. She's there at the hospital. A father trying to bring his son to the hospital. Or let's say accident victim to that particular environment. All this category of persons, do you think they should go for the test?
Oh, in fact, what we tell them, as soon as we make the diagnosis in the hospital, there's something we call contact tracing.
Contact tracing? Yes,
for those who have come in contact with the person. There are different levels of contact tracing, but then, at least to the best that we can do, for those that stay with the patient immediately, the immediate family, those that live with the patients, especially the children, we advocate for this latent test being done so that you don't wait till there's an active disease. You want to nip it in the bud while it's still latent before it becomes active.
So it's easier to take care of it when it's latent than when it's active.
It's better that way.
Now, here comes the question, because you talked about the theme. Yes, we can stop tuberculosis. Can it be stopped in a country like ours? That's a question people really want to know. In Nigeria, can it be stopped?
When I was still in school, we were hoping that by 2025 it would have been eradicated. But here we are, struggling with the menace of a disease. It's quite difficult. Funding is one of the major challenges. Number 2, compliance. 3, stigma. And that's why we're really trying to get this, at least to spread the word around, that this disease can be treated so that people will stop hiding behind saying it's a spiritual problem. It's not spiritual. When someone is losing weight, having low-grade fever, coughing out blood, it doesn't mean the person is gone.
Because someone say once you contract it, it's a death sentence. That is it.
Absolutely not. There are some doctors that have gotten it and have been treated as well. So it is not a death sentence. It can be treated. Now we encourage people to come to the hospital. It may not be the big hospitals. As little as the health centers, people would help at least direct properly. One of the major challenges as well, people that don't come in time come with damaged lungs already. In fact, lately we've been having a lot of patients that come in with already damaged lungs. So,
as in the pair is damaged?
Well, we call it destroyed lung. It means that the patient may just have little volume left. And some of them may require surgery because the damage affecting one side can result in continuous symptoms like bleeding, like coughing out blood. So not every blood that is coughed out must mean the person has active disease. When the patient comes to treat, the disease is cleared and then they can have complications. Those complications can be bad, requiring surgery, and for some requiring oxygen long term. So there are so many complications that can arise. That's why it's better treated in time.
All right, thank you. Thank you so much, Doc, because when I was late, once you get to hear TB, the next thing is run, oh, run away from such
Not
pests. You don't want to get
please. Not
infected.
anymore.
All right, well, you've heard it from Dr. Omage, right?
Omage, yeah.
Yes, that it can be treated. It's not a death sentence. Just go out there, get tested. Don't be afraid. Follow the procedure, follow the tenets, and you will get better. But for the theme, yes, we can stop tuberculosis. It's a possibility. Though difficult, it's a possibility. Just take care of your health. If you don't feel safe around crowded places, just put on your mask, right? That can help.
Yes.
Isn't it, Doc?
Yes, it can.
Just put on your face mask and you just be okay. Thank you so much once more, Doctor, for coming on today's show.
Thank you for having me.
Appreciate your wonderful enlightenment. Now I'm less apprehensive. So when I go to see a TB patient, please don't come there. This is what you should do. I should run for cover, right?
No, please don't run.
All right, that's it on Healthy Living for today. Thank you so much for being a part of it. You have to go get tested. If you know you have this problem, go to the hospital because it can be treated. Bye for now.